This video is going to discuss the possible causes of multiple chemical sensitivity. So basically there are some theories, but there's no unified accepted diagnostic test to prove whether or not you have multiple chemical sensitivity, because no exact cause has yet been proved to the best of my knowledge. And none of this is medical advice, by the way. Consult your doctor for any medical questions you might have. However, there has been a good amount of research done on the subject, and there are some theories that have been put out there by various institutions and doctors and so forth. The ones I'm going to go over are have come from the source of mcsresearch.net, which is a site that is made by James Madison University, and I'm going to go over some of their main theories about MCS causes. So the first one is called limbic kindling, and what it basically means is that somehow damage is done to the limbic system in the brain, usually through your olfactory system, which like chemicals going through your nose basically, and do damage to your limbic system and make you hyper-reactive sort of to other chemicals that might come into your body. The next one is Martin Paul's nitric oxide theory, and basically what he postulated was that in response to some chemicals and too much chemical damage, your body ends up producing too much nitrous oxide, which results in peroxynitrate, which does damage to your blood-brain barrier and your cytochrome P450, if I understand that correctly. And this makes you basically not good at detoxifying chemicals. The next one is enzymatic deficiencies, and what this basically amounts to is that due to dietary or genetic reasons, the given person with MCS does not have enough enzymes to detoxify all the various chemicals that people face today. The next one is immunological dysfunction, and what this basically means is for some reason the immune system gets damaged and does not properly identify and discard toxins in your body fast enough. And this is related to the next one, which is TILT, which is toxin-induced loss of tolerance, which basically means that your body just can't keep up with the amount of toxins that are being dumped on it. Dr. William Ray, who's a renowned physician in the field, talks about this, and he said that basically your body's like, your detoxification systems are like a funnel, and as long as like the water going in does not exceed the funnel's capacity, then everything will go fine. But if you have too much water coming in, it will flow over the funnel. He says this is the same thing for your body's detoxification system, and once it overflows, you get symptoms. The next one is psychological theories, which is basically some people think that it is a psychosomatic disease, which means it's pretty much on your mind. Lyme disease is the next one, and basically people think that your body from chronic Lyme disease can be exposed to way too many toxins, and at the same time its nutrient sources are depleted and the immune system is overwhelmed and damaged, and this can lead to MCS. The next one is airway inflammation, which basically means that due to certain chemicals or molds or whatever, that your lungs can sort of go into a state of inflammation, and it can sort of lead to a chronic asthma-like state, which affects your breathing and can be triggered by various chemicals. And the last one is called canary in the mine, and what it basically means is that the world is becoming toxic due to pesticides and lots of other chemicals that have appeared in the last 50 to 100 years, and these people who are getting MCS are basically just sort of an advertisement of what's to come of the future if we don't get rid of some of these toxic chemicals, a good amount of them, or figure out how to detox ourselves better. My personal opinion is that chronic or multiple chemical sensitivity is probably caused by a number of these things working in combination with each other. For example, your immune system could get damaged due to Lyme disease, which could lead to airway inflammation, which could lead to more peroxynitrate. So I don't know. I'm not an expert by any means. I'm just a lay person trying to figure this out. And I appreciate any comments or questions that you might have. Thank you for watching this video.